From the station working for you, this is WRTV News at 11, streaming now.
There are high hopes after the recent announcements of 2 successful COVID-19 vaccines. Good evening, I'm Amanda Starrentino.
And I'm Mark Mullins. While health officials are hopeful, many are cautioning that vaccines do not mean that life will go back to normal overnight.
Working for you at WRTV's Cornelius Hawker is getting answers to some of your questions.
Within days of each other, Pfizer and Moderna announcing COVID-19 vaccines with a 90 and 94.5% effective rate. But doctors caution this isn't going to take all our worries away yet.
It's going to take time, first of all. We're looking at months. Certainly everybody's not going to get it to start. Your average citizen watching home from TV, unless they are, in a very high-risk population.
Emergency Department Dr. Stephen Samples says more companies are going to have to produce effective vaccines to meet demand around the world, especially since both of the successful vaccines require 2 doses.
If you think about it, 7 billion doses times 2, so 14 billion doses of drug. So the Pfizer and the Moderna, we're hoping that others come right up behind them and start churning out doses as well.
Some have questioned if these vaccines are safe, considering the timeline under which they have been made. Dr. Sample says the answer is yes, because they were produced using messenger RNA, tiny snippets of genetic code that tell cells to build proteins and are the key to unleash the immune system.
Your cell's own machinery are going to pump out the protein that this mRNA codes for. And then after that happens, your body recognizes it and then stimulates your immune response.
As far as how we get the vaccine out to communities, it's going to be a huge effort considering the cold storage and shipping needed. Dr. Sample says there's only one group of people he thinks could handle it.
I think that you're going to see a lot of National Guard members, popping up clinics and stuff like that. That's just, I feel like that is a very efficient government way to distribute something. They just call up the soldiers because there are medics and doctors and nurses scattered all through.
You're still urged to wear a mask and follow all the COVID-19 safety guidelines, especially now and the months ahead.
We've got a really rough winter to get through, and these vaccines are not going to be a factor now. Not for Thanksgiving, not for Christmas, not for anything that we want to do over the next few months. This is all still up to us for now.
Working for you, Cornelius Hawker, WRTV.
Some people have asked if the COVID-19 vaccine could be available in the form of a nasal spray. Dr. Sample says that's not likely given how delicate the vaccine is and the special circumstances under which it needs to be kept until it's administered.
Tomorrow, Governor Eric Holcomb will join the state's weekly COVID briefing by phone. That's because he's quarantining after being exposed to the virus. The governor's office says several members of Holcomb's security detail have tested positive for COVID. Holcomb and his wife are considered close contacts and will be tested later this week. State Health Commissioner Christina Box will lead the briefing tomorrow. She contracted the virus herself last month.
An Indianapolis woman is sharing her story, hoping her battle with COVID encourages others to take precautions seriously.
My big concern was, I've got cancer, kidneys, heart damage. If I have COVID, I'm not going to survive this.
Marcia Nessel has been in quarantine with her husband for more than a week. They both tested positive for COVID. As you just heard, Marcia is especially high risk. Her husband is an essential worker. Marcia says the couple did everything they could to protect themselves, like wearing masks and having food delivered. She says this is how her doctor explained what went wrong.
Community spread is so bad now that it's practically uncontrolled in our state.
Last week, the FDA granted emergency use authorization to an antibody treatment from Eli Lilly.
Anyone who lives or works in Indiana can get a free COVID test. Just go to coronavirus.in.gov for more information. Today, the State Department of Health reported 5,541 new positive cases from October 31st through yesterday. The 7-day positivity rate among unique individuals is 23.2%. And 2,951 COVID patients are in the hospital statewide. One hospital that is struggling with a spike in COVID patients is Columbus Regional Health in Bartholomew County. COVID hospitalizations have nearly tripled in the past 2 weeks. The dedicated COVID unit is at capacity right now. Officials are looking for ways to add more beds and resources. Staffing is also a major issue.
We need to free up beds, of course, but beds don't care for people. People care for people. And so we need those nurses by the bedside. We need those physicians. We need them healthy. And I think that's our greatest resource that we have to protect. So when we are urging the community to please, stay home as much as you can. If you go out, mask up, social distance, do all those things we've been hearing for the last 8 months, because it directly affects our valuable resources, which is our staff.
To make more beds available, Columbus Regional Health is evaluating procedures that require an overnight stay and asking people to hold off until hospitalizations ease.
Hamilton Southeastern School is the latest in a long list of districts to announce some students are moving to all virtual learning. Pre-K through 6th graders will return to remote instruction later this week. HSE leaders say a strain on staffing is behind the decision. They say 94 teachers and instructional staff members requested a sub today. The district's current fill rate is only about 50%. Some parents are frustrated by the short notice.
There's not a lot of time to scramble to figure out things right now. My son's in 3rd and my daughter's in kindergarten, so it isn't like you can be away from them while they do it. You have to monitor that.
Students in grades 7 through 12 at HSE are already attending classes virtually. In Marion County, the latest public health order announced last week requires all Marion County schools to return to virtual instruction by November 30th.
Now to the forecast. It's cold right now, but warmer days are ahead. WRTV Chief Meteorologist Kevin Gregory joining us now with your forecast.
And Mark, our temperatures tomorrow morning start in the mid-20s. That's rock bottom. We'll warm up from there. It's already down to 30 in Fishers and Greenfield. Other temperatures in the low to mid-30s. The sky is clear and the wind is calm. That's one change since we got together earlier this evening. There may be a few mid-level clouds around. Temperatures continue to fall across the entire state into the 20s tonight. That's what we wake up to. Temperatures in the mid-20s will not be that cold again over the next 7 days. We make a recovery in the afternoon into the upper 40s and lower 50s with sunshine. When you can expect temperatures in the 60s, and we'll talk about rain chances returning as well in just a bit.
President Trump has fired a top Homeland Security official. ABC's Alex Brochet reports the move comes as the White House refuses to grant President-elect Joe Biden access to key resources and information.
President-elect Joe Biden today briefed on national security issues by outside advisors.
You know that I've been unable to get the briefings that ordinarily would have come by now.
That's because the Trump administration is denying him access to classified government intel. The president is also blocking Biden's team from briefings on the pandemic, a move that Biden warned could cost more lives and delay the distribution of a COVID-19 vaccine. It's also frustrating for Dr. Anthony Fauci, who's eager to bring the Biden team up to speed on the pandemic. Fauci telling CNN,
"It's important in every level to have a smooth transition."
But President Trump refuses to concede. Instead, he's waging unsuccessful legal battles over the election. Today, another one in Pennsylvania. And in Georgia, where the manual audit is underway, the Republican Secretary of State says he's getting death threats after coming under attack from Trump and his allies.
Well, it's surprising it's some of the vitriol and outright lies, and then, some of the threats that you get.
And tonight, the president firing Christopher Krebs, the director of the Cybersecurity and Infrastructure Security Agency, the federal agency that has vouched for the reliability of the 2020 election. In a tweet, Krebs responding, "Honored to serve. We did it right." Meanwhile, just over a week after the president fired Defense Secretary Mark Esper, who warned the White House of the dangers of a rapid withdrawal from Afghanistan, Trump's new defense secretary made it official.
By January 15th, 2021, our forces, their size in Afghanistan, will be 2,500 troops. Our force size in Iraq will also be 2,500 by that same date.
That will mean 2,000 fewer troops in Afghanistan, 500 fewer in Iraq, a far more rapid withdrawal than anyone planned. But within hours of that announcement, rockets were launched near the U.S. Embassy in Iraq, reportedly killing a child. Alex Perche, ABC News, Washington.
Coming up, how a new program is helping give parents a voice when it comes to their children's education.
Health officials are calling on Americans to avoid large family gatherings this Thanksgiving. But for those who are celebrating in person, there are ways you can minimize the risk of spreading COVID-19.
WRTV is looking ahead to Christmas. Our annual toy drive is underway. You can drop off new unwrapped gifts at several U-Store locations. We'll also be collecting donations at Indianapolis area Simon Malls on December 5th. For more information, go to WRTV.com/toy drive. There's no doubt this school year has been frustrating for parents. Overseeing at-home learning can turn into a full-time job itself, and it's hard to know where to turn when issues arise. Well, that's where a new nonprofit hopes to step in with a program that can help ease communication between parents and schools to make sure students are getting the education they need. WRTV's Cameron Riddle shows you how it works.
Being a parent is no easy task, and being a parent of a school-aged child is harder today than ever before, thanks to the coronavirus pandemic.
Technology, obviously, is on a whole nother level now. There's a digital divide. There's so many obstacles.
Overcoming those obstacles is the goal of a new nonprofit organization called Empowered Families. Ante Johnson is the program's executive director and says the goal is to make sure parents and school leaders are not only hearing each other, but understanding each other so students can have everything they need to learn.
There are moments when parents are frustrated because, listen, they're at their bandwidth may not be what it should be because they're working 2 or 3 jobs, right? Single mom trying to make things happen.
Claire Pope knows how complicated a school system can be. She's a mother, grandmother, and a heavily involved grassroots organizer on Indy's East Side. That's why she's among 8 local community leaders selected by Empowered Families to serve as community liaisons between area parents and schools. Her task is to be the voice for parents and make sure Indianapolis school districts are talking with parents before making big decisions like changing curriculums or even closing schools.
If the parents are already running behind with understanding how the school system is operating, and then you turn around and changes are being made through one entity or another, then all that does is multiply the problem.
In a time where just about everyone is apart, but still working to move forward, there is an added push to make sure families and children aren't left behind.
I can be that medium, that person in the middle to make or bridge to help clear any inconsistencies between what the families are trying to say and what the schools are hearing.
Cameron Riddle, WRTV.
Well, parents of any school district who feel like their concerns are not being heard can contact the Empowered Families team at their website. You can find more information at ours at WRTV.com.
Well, our temperature turnaround begins after a cold morning tomorrow. We'll gain some momentum in getting temperatures back into the 50s. Clear and cold through the morning hours tomorrow. Next 3 days are dry. I'd say our best chance for rain coming up will be on Sunday, and the strongest winds ahead arrive Thursday. There are the temperatures in the morning, 20s to 30s already in spots to the north. Will be about 5 degrees colder than what you're looking at right there. In the morning, the wind is calm, but look what happens as we go to the afternoon. It's not just that the wind will be gusty again, but out of the south. That will boost our temperatures. South wind gusting to 20 carries the high to 51 in the metro area during the afternoon hours, 52 in Terre Haute and Bloomington. You'll struggle to hit 50 anywhere from Peru over to Marion, Muncie, and Richmond. The warmer air will take an extra day to pull 60s into the state, but that's what happens as we get to Thursday. About 10 degrees above average for this time of year. The wind will be stronger than tomorrow, gusting almost 40 miles per hour once again out of the south, southwest. Seems like we've had our share of very windy days this fall. Of course, you remember Sunday we had over 60-mile-per-hour gusts. Saturday and Sunday, temperatures lower 60s. The chance for showers is greatest on Sunday, 62 for the high, and that really should be late in the day, Sunday into Sunday night. Decent rainfall, could be half an inch or a little more in spots across most of central Indiana, another soaking rain. Monday, you're looking at 50, so it's cooler, then coolest on Tuesday at 46 degrees. That 7-day planner, temperatures in the 20s tomorrow morning, but look what happens. Lows by early weekend or Sunday morning will be around 50. The chance for showers increases Sunday. Now, Monday and Tuesday, temperatures are falling backwards, but indications are after that into early December, we'll still have above average temperatures, but look what happens. Average temperatures by that point are middle to upper 40s, and will be near to below average as far as precipitation is expected. We'll continue on this a little roller coaster where temperatures will go up and then back down for a while, but at least we're not consistently down. Amanda?
All right, thank you, Kevin. A major project to redesign the North Split is set to start in 3 to 4 weeks. The Indiana Department of Transportation says pavement and bridges will be replaced. Traffic patterns will be reconfigured to improve safety, and new lighting and landscaping will be added. The construction will lead to some closures. You can find that information by going to WRTV.com and clicking on this story.
Health officials say avoiding large Thanksgiving gatherings is the best option this year to prevent the spread of COVID-19. But if you do choose to celebrate the holiday in person, there are ways to improve safety. Amber Strong with our partners at Newsy has what you need to know.
First, the bad news. If you were planning to quarantine in order to travel for Thanksgiving Day, you've missed the 14-day mark. The good news is experts say there are still ways to safely celebrate the holiday at home.
As we approach the Thanksgiving holidays, we're all thinking about how we can get together and try and feel normal.
When it comes to Thanksgiving, the experts say celebrating virtually or with your immediate household is best, bottom line. However, the CDC has put together guidelines for those who choose to gather in person, including hosting the gathering outdoors, avoiding potlucks, encouraging guests to bring food for themselves, avoiding shared items like condiment bottles, and requiring masks for all attendees. Infectious disease experts say the guidelines don't eliminate the risk.
As you take that mask off and talk and eat or drink at the same time, there will still be risk that will occur during that period for the spray of aerosols or droplets.
Ultimately, social distancing this holiday is the safest measure.
The next best bet after a virtual gathering is to do the kind of drive-by front yard gathering that we did earlier in the pandemic. You can see one another, exchange those pleasantries, keep it at a distance with masks on.
For those who choose a virtual feast, online meeting platform Zoom is waiving its 40-minute limit on free accounts on Thanksgiving Day and expanding the time families can gather safely.
It's not a normal Thanksgiving. It wasn't a normal Halloween. It won't be a normal Hanukkah or Christmas. And 2020 won't be normal, period.
Across the country, COVID-19 hospitalizations are on the rise. Local officials in Michigan, California, Iowa, Pennsylvania, and New Jersey are among the list of states with newly implemented restrictions on the number of people allowed to gather indoors. President-elect Joe Biden is encouraging people to follow the guidelines of small gatherings and masks.
I just want to make sure that we're able to be together next Thanksgiving. Next Christmas.
Now, if you do plan to travel out of state, check the local guidelines. Many states require visitors to quarantine upon arrival. Amber Strong, Newsy, Northern Virginia.
The IU men's basketball team is scheduled to tip off the season next week without fans in the stands at iconic Assembly Hall. The university says men's and women's basketball home games will be played without fans indefinitely. The athletics department is working with health officials and the Big Ten to determine when or if that will change. The men will host Tennessee Tech on November 25th. The Colts are teaming up with the State Department of Health and Meyer to host a free flu shot clinic at Lucas Oil Stadium. It goes from 7 a.m. to p.m. this Friday. Anyone age 11 or older is eligible. Health insurance is not required. You must fill out paperwork, have your temperature taken, and pass a verbal COVID-19 screening before receiving the flu vaccine. There is a drive-through clinic option as well.
In an effort to better protect travelers and workers during the pandemic, some airports have added PPE vending machines or high-tech cleaning devices. Now others are taking COVID precautions a step further. Scripps reporter Stephanie Stone reports a handful of airports across the country are now offering testing.
It's no secret that the global pandemic has turned the travel and airline industry upside down. Airport Council International North America is known as the voice of airports.
I look at airports as cities within cities, and anything that would affect the city would affect an airport. That's what we do.
And these days, CEO Kevin Burke says it's COVID.
Testing is that key that unlocks travel.
Tampa International Airport was the first to jump on board with a program that was the first of its kind in the nation. They offer both the PCR and rapid tests to anyone with proof of travel.
We've tested more than 4,100 passengers. So it's gained in popularity. Passengers know that we are providing the testing at the airport. And I will tell you, before they open up at 7:30 every morning, there's 20 plus passengers waiting in line.
John Tiliakos is the executive VP of airport operations and says they launched the program in early October in hopes of instilling confidence and encouraging travel.
Given the environment we're in with this pandemic, we have got to do everything we can as an industry, both in the airline industry, the airport industry. We've got to do everything we can to breathe life back into this industry and get it back up on its feet and running again.
Since then, they've fielded calls from other airports inquiring about the program. If a passenger gets a negative test, they go on about their day. But if it's positive, ACINA says it's not the airport's responsibility to escort them out.
They've gotten very few passengers that have been tested positive, but they've had a couple, and they've had to ask them to, they can't proceed past that because TSA is not going to let them through a checkpoint with a positive read.
While an increase in testing is a good thing, doctors advise this is not a guarantee by any means.
This test isn't an insurance policy for the rest of the week or the rest of the month or the rest of your life. It tells you what your status is right now.
Dr. Beth Thielen is assistant professor of pediatrics at University of Minnesota Medical School, and she's an infectious disease physician.
For example, if you went to a bar the night before you flew and you were around, 100 people without masks, you potentially could be infected. But if you take a test at the airport the next day, you may very well test negative, and yet a week down the road you may in fact develop symptoms of COVID and be capable of spreading COVID.
But she says this is a start and it helps people make better decisions about what they're doing and where they're going. ACINA says the testing, masks, social distancing, hand washing, cleaning, all of it together plays an important role in getting people back on board.
If our industry is going to survive and thrive when a vaccine is there and people come back to travel, we have to take the steps now to make people comfortable, not only now, but in the future when they're booking future travel.
I'm Stephanie Stone reporting.
Rise and shine, and the sun will shine during the day tomorrow. That'll help boost those temperatures from the 20s to the mid-40s by lunchtime. Afternoon temperature about 51, and it turns windy again in the afternoon. Mark?
Bundle up tomorrow morning. All right, thank you, Kevin, and thank you for joining us for WRTV News at 11. Join the GMI team starting at 4:30 tomorrow. Have a good night.